Joel McCullough, Spokane Regional Health District.
Ed Pace, Spokane Valley City Council.
John Snyder, City of Spokane.
Anne Snuggle, Recording Secretary. Michelle Fossum, Legal Counsel.
Bob Lutz, appointed member.
Chuck Abner, City of Spokane, and Chair.
Kevin Freeman, Mayor of City of Millwood and Small Cities Representative.
Well, as some of you know,
And I want to remind you one time again, what am I going to remind you of?
that I have a limit.
That's right, you have 3 minutes.
And my name is Rosemarie Waldrum Larson. When I first started attending these board meetings, it was in May of 1997. And that was because the late Betty Fowler, founder and director of Safe Water Coalition of Washington State, had discovered that there was a deliberate move to use the Board of Health as a means of intimidating or coercing the city of Spokane into mandating fluoridation again. In 1984, I brought a civil lawsuit against the city of Spokane, stopping that kind of action. Unfortunately, policymakers have been in the works since then.
Have been what?
And have policymakers, this is, as I reported to the board a few years ago, this is how the city of Port Angeles was fluoridated without its being aware of the fact that when you get elected officials to vote for policy to replace the law, then you cannot remove it unless it is litigated.
Okay.
And so that is pretty much the situation now in the state of Washington regarding a lot of issues. I'm not going to take up too much of your time. I'm just going to say I hope you have a pleasant holiday. Remember that there are individuals, fluoride allergy does exist. I am one of them. I am medically double-blind, controlled, tested. I used to live in Kingston, New York, which is the still unfluoridated control city that was used back in 1945 to 1955 in the Newburgh, New York State Health Department epidemiological observation of fluoridation that was foisted on the citizens of Newburgh without their knowledge or their consent. And what it proved after 1955 has been covered up and kept silent. If you have any questions, you're free to ask me. Although I find it interesting that in the years I've been attending these meetings and giving testimony, there have only been about 3 or 4 that have asked questions. Now, are you either all that smart, that intimidated, or that ignorant?
Right, but I think, you give us information that we read, so we appreciate that very much. Okay, thank you.
Thank you.
We do now have a quorum. Thank you, Shelley. Health Officer report, please.
Good afternoon. Today I'll be covering retirement in the Environmental Health Division, our Division Director, brief respiratory disease update, and the public health response to the windstorm. So in terms of the first item, David Swink, the current Environmental Health Director, who's sitting back there in suspenders, has announced his retirement, and he will be retiring. His last day will be in January of next year. And David has a long, distinguished service in public health. He's been in public health about 38, 39 years, and over 20 years here at the health district. And he served in some really key leadership roles. He's been the chair of Washington State local association, local public health officials, and the Environmental Health Directors Group. And under his leadership, the Environmental Health Division here at the Health District has been known throughout the state in terms of the quality of the work and innovation. So I'd like to really thank you, David, for your service. He didn't really want me to say much, but I did anyway. So the current job is open. The division director job is open, and we hope it to be filled by the time David leaves in January.
I'm sure we'll do this in January again, so. Oh, we won't? Officially you're going to retire in January, but you're not going to be here in January. Okay, then we are correct in saying thank you very much at this stage then. Okay, good.
So in terms of the respiratory disease update, this mainly centers around influenza. Our levels are still fairly low here in Spokane. We've had one laboratory confirmed death from influenza this year, about 5 hospitalizations, and the levels are continued to be low, but we don't know when we'll have an upsurge, because we generally do have an upsurge, but it's difficult to tell when that will be. And we'll be reporting on that as more information comes in. So the final item is the public health response to the windstorm. And as the local public health agency, we're responsible for emergency support function H8, which includes medical, public health, and mortuary services. And for this windstorm event, we're responsible for coordinating medical needs. And that including, for this event, we opened some medical needs shelters that were co-located with the Red Cross. And we supported these medical needs shelter with local partners. We also activated our Medical Reserve Corps to provide medical services. In addition to that, we did vaccinate some of the vulnerable populations that were located in shelters as well. And for this storm, the Joint Information Center was activated, and the SRHD PIO was located there most of the time, helping to provide communication messages out to the public. And some of the key messages that were communicated were the dangers of carbon monoxide poisoning, what people need to do to prevent hypothermia, provide information about food safety to the public, and let people know about the shelters and the medical needs shelters and where they were located. And also the food program worked with the different types of food establishments in the area to ensure that food safety continued despite the lack of power in many of these establishments. And the program staff advised what actions that food establishments needed to take if they had no power. And ultimately, much of the food had to be thrown away because they were not able to maintain food at proper temperature without sufficient power. So that was ultimate outcome for many establishments. So that's kind of a summary of our response to the windstorm. Are there any questions?
Any questions you have, Dr. Jones?
Well, not really a question, but a comment. I really appreciated the health district's efforts in getting information out and also participating out at the fire training center with the operations there. I felt that was really beneficial to the whole response. Was someone from the health district out there today for the hot wash kind of review of the response?
Yes, we have several of our public health preparedness and response staff who are out there, and then we provided input here locally to provide input there. So, yes, we are represented there for the hot wash.
Well, one of the things that I wondered if we could have done better as a community was when we went out in the city of Spokane, did door to door. We really didn't. We were just blanketing kind of zip codes. Precincts, not really able to focus on maybe vulnerable individuals. Now, how do we get that information? It's hard. I mean, there's privacy issues there, but it is pretty easy to figure out where at least our elderly citizens are. And I'm hoping that in the future that we can figure out how to do some more targeted outreach to those folks that are really vulnerable in a situation like that.
Yep, that's part of the comments that we've had in terms of how better to do that type of outreach, because we've identified different resources that are available that we did not know before the event that we could do better targeted outreach. So we agree with that.
Great. Thank you, Chuck. As most of you here recall, we did a survey 2 years ago, and then we followed that by interviews with each of the Board of Health members. And that really led to the formation of the Governance Committee and to all of the work they've been doing over the last couple of years to enhance the work of the Board of Health. And the Governance Committee chose this year to repeat that survey kind of as a way to monitor progress and kind of see how the committee is doing and what other work they might need to be doing as the years progress. The questions in the survey are all the same as the last time around, with the exception of the first set of questions. Those changed a little bit because they're very specific to some of the work that the Governance Committee has done over the last year. We've also included a comment box after each section. And each of the sections are based on the governance responsibilities. So there's the first set of questions and then your 5 governance responsibility sections. And so we included a comment box there in case you want to explain any of your answers. Thought that might be helpful. And then the way it's structured, we're going to be handing out some iPads for you to answer on. The way it is set up is you have to answer all the questions in each section before you can move on. And then remember, you're going to be answering from 3 different perspectives. One is you're answering collectively as the Board of Health, how do you think you're doing? Individually, how comfortable you are doing those responsibilities. And then the level of staff support that you feel that is needed in order to help you do your work. So we're going to hand these out. They should be preloaded. If not, we'll get you set up on those. And I believe we have, 10, 15 minutes set aside for that. Is that right? Yeah, 15. All right. Thank you, everybody, for participating in that. I'm sure that was stimulated TV watching for anybody looking at the meeting. So did everybody find the technology okay on that? I know, poor Chuck, yours shut off on you, but... Okay, so just to let you know, what we are going to do is send the survey out to the members who weren't able to make it today. That way we can get as much participation as possible. We will have our data center then tabulate the results for us, and we'll be bringing those to the Governance Committee, and then any particular findings we'll talk with them about and whether we bring that forward to the full group. And hopefully that will then sort of shape the work of the Governance Committee over the next year or so. So, thank you.
So at this time, I open nominations for the chair position, please. Okay. Amber?
Thank you, Mr. Chair. I'd like to nominate Mayor Freeman from the City of Millwood.
Do we have a second to that?
I'll second.
Okay. Any discussion regarding Kevin? All those in favor?
Sounds kind of funny.
Okay. All those in favor signify by aye.
Aye.
Aye. Congratulations, Kevin. That's called the toot-toot job, I think. Is that what that's called? Also up for election is the vice chair. Are there any nominations for the vice chair? Miss Doctor.
Who?
Doctor.
Oh.
Mr. Doctor.
See, I either call him Doctor, I call him Bob, I call him Robert. See, what else? The other names that I keep calling you?
I don't think they're really.
Yeah, okay.
Exactly.
Anyway, you're on, Doctor.
Thank you. I'd like to nominate Commissioner O'Quinn.
Second.
Second to that?
Second.
Any discussion regarding Shelley's nomination? Hearing none, all those in favor signify by aye.
Aye.
Congratulations, Shelley. I think that the district with the 2 of you involved next year will work out very, very good. Thank you very much. Okay, let's go to resolution item number C8C, resolution 15-07, authorizing staff to execute an MOU with WSNA for calendar year, and I won't read the remainder of that. I think that we have discussed it on numerous occasions. However, if you have any questions, we have our expert retiree soon that will ask you any questions you might have. So I would like to ask for a authorization for this resolution number 15107, please.
I move that we approve resolution number 15-07.
Second.
Great. Any further discussion regarding this? All those in favor signify by aye.
Aye.
Those against? Thank you very much. Now, Lindy, back up to you again, please, on the 2016 legislative agenda. And Linda, one of the comments that we brought forth in our STA board meeting yesterday was that sometimes there's some common themes to resolutions that we might have, the different agencies. So once and if this is approved, I would request that you send that over to STA. Who would be the person that?
Susan Milbank at STA.
Susan Milbank, because I know there are some mental health items both that STA is looking at and we are, and so I think it would be good. And then I think also we're going to be asking different Chamber of Commerces and see what their agendas are so that we can kind of unite our forces with that. So
Sounds
if you
good.
do that, I'd appreciate it.
I sure will, and I've already been in touch with the county. Last meeting we discussed that, and I was in touch with them, and so we'll be in touch with them again following our action here today.
Okay, thank you.
So this is the last step in setting our legislative agenda. What I would like to do today is have your discussion about the proposals that have come forward to be put on the legislative agenda, both determining the final list of what you want on or anything you want to take off, as well as prioritization amongst the issues. And then we also will follow that once you've decided on the agenda with a resolution to adopt it. So any discussion on the items? We've talked about these for a couple months now. But any final discussions, comments, questions, changes?
Okay, John?
I'll just note that the mental health agenda item is similar to one that we passed last week at the City of Spokane. We worked with Christine Barada for the language 4 having to do with the RSNs and Medicaid reimbursement and Eastern State Hospital, and also the change of name from the RSNs to the regional, behavioral?
BHS.
Behavioral
Health Organization.
There we go. So it's great to see that on here as well, and I'm hoping that will continue to be a countywide priority because we all deal with the impacts of that.
Yeah, and I think that's extremely important.
Yeah, and since you mentioned that, I'll just point out that the mental health and substance abuse appears both under your policy issues as well as under the budget because of the two separate elements to those.
So any further questions for Linda, please?
And in terms of order of these, is this an okay order for you? Did you want to move anything around? We haven't necessarily made anything a top priority, but it tends to be when you put something at the top of the list, that tends to be what people assume.
Well, my personal feeling is that you can make that adjustment as you are extremely involved over in Olympia, because you'll know what the kind of the theme and what's going on. And I think at that time, you can see what's happening legislative-wise and where the conversation is going, and you can add that. That would be my feeling about it.
Any other comments on that?
Okay. How many motion to adopt, please?
So moved.
Second.
Okay. Any further discussion? All those in favor signify by aye.
Aye.
Okay, thank you very much. Okay.
And do you need a separate motion on the resolution, or does that qualify for both?
If we're doing the resolution, we should announce that.
Okay.
Okay, so we need to go back then to the resolution 15-07. Okay. Do we need somebody to make that as a motion then, Michelle?
You mean 1508?
1508. Yeah.
Oh, I'm sorry, 1508. I'm sorry.
Move adoption of 1508 as presented.
Okay.
Second.
Okay. Now, any further discussion? Hearing none, all those in favor signify by aye.
Aye.
Okay, thank you very much. Now let's go to resolution 15-08. Resolution 1509. I'll get my dates here regarding to the temporary food establishment permit. And Ray will be making a presentation for us, please. And Shelley, you should add any comments you might have at this time, okay?
How do I minimize that? There we go. Okay, just wanted to say thanks for the board to allow me to present here. Oops. And just wanted to, this is an ad hoc committee that was formed by the board back this spring to address concerns that were raised for TFE fees and how we currently conduct TFEs. So first, just wanted to acknowledge all the members The first Commissioner Shelley O'Quinn, who was the chair for this committee, Chuck Hafner, board member and current chair and member of City of Spokane Valley, Kevin Freeman, board member and mayor for City of Millwood, Dr. Bob Lutz, Spokane Health District board member, Tom Truelove, who was a former board member for the Health District and also mayor for the City of Cheney, Jerry Pedersen, who is a current member and representative on the Food Advisory Committee, representing food establishments, and he's also the owner and director of operations for Spokane Arby's. Diane Huff, who is a Food Advisory Committee member and owner of Sand Trails Farms, and she represents the temporary food events on the committee. Brian Dickman, who is a former member of the Food Advisory Committee and current owner of Pizzerita, and Brian also is a very active member in the temporary food events here within the county. Our administrator, Tony Smith, Michelle Fossum, our legal counsel, John Shervey, the technical advisor for the food program, and myself, Ray Byrne. So, as far as activities that we were done, one, I think we set out for 3 objectives when we tried to do this, and one was to look at, is there a way that we could recreate a fee structure that would make it more equitable for smaller venues, and then also for people that are operating at, say, a one-day event versus something like the Fair or Pig Out. The second thing would be to, within that fee structure, make it accountable so that we would not put too much burden on other permit, because we are under 100% fee recovery. We attempt to do that so they wouldn't shift that to the other permits or take money out of the general fund, which we feel that we have done that. So, and then the last thing, which I think is the most important thing, would be to continue to offer a service through the district that would not jeopardize public health. So these were all kind of things that we took into consideration when we did this. We had a series of 5 meetings, I believe. And the first couple of meetings was just open discussion to see what are the concerns that the committee has, as well as what had been brought forward to some of the commissioners and board members and the others. Some of the pros to reducing the fees that we currently have were, one, there was a concern about that because of our fee structure, that it was inhibiting small cities in that to hold venues and recruit temporary food events into that. So by lowering the fee structure, that would encourage them to do that. It would allow more economic input into those smaller communities, again, because you're bringing those community events in, temporary food events, providing the food would increase the participation. Then one of the other things is that there was a concern that with vendors that wanted to sample their products, and by doing a lower cost, it allowed them to get their product out there, sample it, and hopefully sell their product at a lower cost. So those were some of the pros that we had looked at. Some of the cons to decreasing that, one is that we are under 100% fee recovery for the district, and so that would reduce the revenue. Now, how we had seen that in the past is that we were treating that on a permit basis, not necessarily on a program basis. And so that was one of the clarifications that we got from Michelle is we can balance that budget within the program and not necessarily with the permit. So it gave us some flexibility there to do that. And then lastly, I think one of the things that was a little bit of concern to the food program is that whenever you're dealing with new vendors, your time actually increases because there's that knowledge base and whether they're prepared or not. So that was a concern of, can we make the reductions necessary in the food program, but at the same time bring new vendors in and still protect the public's health. So a couple of things that we took on as a food program was some research with other local jurisdictions. What we'd found, and we had done this research previously, was, again, you're not comparing apples to apples. Other jurisdictions, of the 34 jurisdictions in the state, some of them have 100% fee recovery like we do, and others can go as low as 30 to 40%. And so then the health district or the counties are pitching in to help pay for those permits. So it's really hard to compare that. The other thing is that there is no commonality as far as structure. Here at the health district, we have basically 3 levels: a low, medium, and a high risk levels. When you look at some of the other jurisdictions, they could have 2, they could have 10. There really is no consistency there. Some of the other jurisdictions, our policy here is if we issue a permit for a temporary food event, that we inspect that, and that is in compliance with the current WAC, the state, Washington State Retail Food Code. Other jurisdictions don't take that same stance, and so they may issue a permit, but they may not necessarily be inspecting it. So their costs vary from where we are. And some of our permits here, we issue an annual permit, which allows you to operate throughout the entire year. You could operate 1 time or you could operate 20 times, and there's no additional cost. Some of the other jurisdictions don't have that. So that was kind of, when we're looking and comparing to other jurisdictions, that was a hard thing to do. At the same time, this has kind of developed to be a statewide issue. As we started checking with other jurisdictions, Seattle-King County had also just hired a third party to come in and do an independent audit on them to take a look at their fees. And out of that audit, their recommendation was to see a 100% increase in most of their TFE fees up to 130%. But when that went to their board, they had the same concerns, is that you're going to prohibit vendors coming in. It's going to be an economic impact as well as a community impact that people are not going to be able to operate. So at that point, they froze their fees and they formed a statewide committee to take a look at that. And so we got involved in that. John and I got involved in participation with that committee. And it was Seattle-King County, Snohomish, Tacoma, Thurston, and Washington State Department of Health. And what we were trying to look at was the exact same thing that we as an ad hoc committee were looking at here. Can we redesign the TFEs and the fee structures around the state to compensate and still encourage the events going on, but at the same time trying to get the cost recovery? And what I can say out of that, the 5 jurisdictions, that we were hoping for more of a common theme, and it really didn't happen. There's so many different fee
That's
policies.
really unusual.
And it's and it's very typical. But I think that just kind of goes to confirm what we're doing. A lot of the things that we do here, as far as how we inspect and our concepts, they really like those and they endorse them. So I think it says something about Spokane County and how we go about inspecting in that and the safety level that we have. But the bottom line is it's hard to compare us to the others. So there really was no common theme out of that. So once we had all that information, we put forth about 5 different fee structures. The one thing that the committee wanted to see was they were okay with the 3 levels, level 1, 2, and 3, which is basically is low, medium, and high. But they wanted to see a tiered structure within that, which would allow somebody to come in, and if they wanted to do a single-day event, it would be a much cheaper rate. And if they wanted to do a 2 to 5, then it would be somewhere in between. And if they had an annual permit, then they would be paying full cost or a little bit above to compensate. So that's what we went in with. And we put proposals out there that varied anywhere from 61% recovery to 100% recovery. And I think there was some good discussion on that, sometimes heated discussion on that. But I think it was realistic that, under our current the way we do things, it's not realistic at a 61% recovery. At the same time, it's not really realistic to try and redesign on a 4-tier system to recover 100%. So once we had taken all that input, Commissioner O'Quinn, Torney, John, and I got together and took a look at the different levels, and we came up with a recommendation back to the ad hoc committee that was about an 83% recovery of where we were, and we based these off of year-end figures for 2014. Because 2015, we don't know where we're at yet. So, which we thought was a good compromise. It allowed because of the tiered system, it allows a much cheaper rate for somebody that only wants to come in and do a single day. But also gives that ability and doesn't hinder the current process that if somebody does 10 or 15 events a year, they can do the annual and it's still a respectable fee. So, and that's what you will see. So this is what we came up with here. And if you look at that, we retitled them. So it's level 1, level 2, and level 3. They currently correspond in the parentheses there. That's what we currently have our permits at, is low, medium, and high. So as you can see, it's just a graduated scale, single day, 2 to 4 day, 5 to 21, and then an annual permit for each one of those categories. So that would be the recommendation that's going to go forth to the board. Now, a couple of the concerns I think that we were looking at as far as a program and how do we do this, the impacts that we would have would be, one is we don't know what this is going to hold. We don't anticipate that this is we're going to see a doubling of our TFE numbers, because most of our events are large events, and the participants are dictated by the promoters. So I would say 75% of our events or more we're not going to see any change in them. Peg Out, they have set number, Hoop Fest, Fair, all those events. So we don't anticipate change. What we do think is that this is going to hopefully promote the smaller venues. Lake Tahoe, Rockford, City of Cheney would allow them to do single-day events or smaller events and recruit people in there at a lower rate. So we do think that we'll see some impact, some increase in TFEs, but we don't know how much. One of the things that we worry a little bit about is that we're going to see a shift, because it's cheaper now to do the higher risk foods. In the past, our fee structure helped to push people into those lower risk foods. Or now, because it's cheaper to do these, that it might have somewhat of a reverse, and it would encourage them to go back and now offer more larger menus, which could stress staff just in the fact that we may have to go see them now. But again, I don't see that as large scale. I think if it's going to happen, it's going to be small scale, and we can mitigate that. Some of the actions that we have already put into place as a program is, one, we know that about the only way that we can reduce our cost is to reduce our staff time that's associated with TFEs. So we have already redesigned our application, made it more explicit to get the processes and stuff that they do, which puts the burden on the vendor to supply that information, which reduces our pre-interview time. So hopefully we'll see some reductions there. We have redesigned our pre-operational checklist that we would phone the vendors, go through it. Again, hopefully shaving some time off that and reducing that. But I think where the big changes are going to be with us is going to be more the fact that we're going to put more burden on the vendors. So the expectations are going to be higher. And this was some of the discussion that came out of the committee is that you need to shift the workload to the vendors and to the promoters, and to the individuals, the vendors that are not performing well. So if they're not performing well, increase your enforcement of that, enforce that issue, and don't penalize the ones that are doing well. So we're kind of taking a look at that structure too, and how we can impact that. But the bottom line is that we're going to put the burden on the vendors. When we receive your application, we will attempt to call you. We'll give you time to reach us, and it's your responsibility to get back to us and make sure that your pre-operational is done. And we've done that to some degree, but we can go further. The other thing would be to notify the promoters that it's your responsibility to help us help the health district. It's your event. You need to step up, help get those applications into us. If we need to get out to your vendors, get that information out and assist us, which again is going to drastically reduce our time, because a lot of our time right now is spent up front working with vendors and promoters just trying to get the applications in. So if we put that burden on them, hopefully that will drastically reduce that. And then the last thing would be that we would step up our enforcement. So if we have vendors that are performing poorly, that we would put them into the enforcement procedure, which is an additional fee. So if we take them to a first reinspection, they would be paying for that service. And again, we're not penalizing the other vendors. That if we show up to an event, if they are not properly set up, right now we'll work with them, we'll close them, but we'll go about the rest of the inspections, we'll go back, we'll reopen them. With this, we may have a less presence at some of these events, And so it may end up in full closures of the establishments, which I think certainly you guys are probably going to hear about that if we do. But I think that again, is putting the burden back on the vendors. If they're going to operate, they need to be ready, and they need to be set up and ready to go. So I think through these steps that we've taken here, and they're going to continue to take throughout this pilot project, which this is as proposed as a 2-year pilot project, I think that we should be able to come very close, or certainly, hopefully, reduce our time that we could even go further with this. But at this point, I think about a 17% reduction in our time. We're looking at about 120 hours, 150 hours, which is a lot of time. But we think that we can do that. So.
Also, right now, this is a 2-year pilot program?
Correct. So what is proposed in the resolution is to treat this for the calendar year 2016 and 2017, that these would be the set fees.
Okay.
We would take a look at it based on how, I don't know that we're going to know fully at the end of 2 years the full impact of the things that we've done, that we've implemented, because we won't know what our costs are, our recovery, until probably March of 2017 based on the 2016 year.
And of course, we'll be ongoing, we'll be evaluating it as we go, so I understand that.
Yeah.
Okay.
And, hopefully we can, through the reductions, the one thing that we have to be concerned with, number one, is public safety. We don't know where the threshold is. So if we reduce our time too much, our presence at these events, because we know that our presence, we could be at Pig Out or the fair and not necessarily do an individual booth inspections, but our presence has an effect, and they do much better. If we're not there and we reduce that, we may see an uptick in violations, but we don't know where that threshold is.
Okay. Any questions of Ray? John?
Ray, what's the thinking behind having the annual recurring event charge be more than like the 5 to 21 consecutive day charge?
So the 5 to 21 days, so that would be encompass our events like Pig Out, Hoop Fest, and that. So if you did the annual permit, we would only inspect you once. And we had to come up with a system in which we could try and push that recovery rate higher. And so the thinking was that if you're at 5 to 21 days, you should be paying more than the 2 to 4 because you have more ability to recoup your costs. Same thing with the annual fee. If you're doing multiple events throughout the year, you have the ability to recoup that cost.
So let me make sure I understand. If let's say somebody comes in from Montana and they're doing Pig Out, they fall into the 5 to 21 consecutive day category?
Correct.
Okay. So if somebody is doing a reoccurring, Pig Out's a reoccurring annual event. So what would be
you're referring to level 3 under the annual?
I think he's trying to define what's reoccurring.
Okay.
Yeah.
Yeah. So an example of that would be a farmer's market or Green Bluff, the Apple Fest. So those are not consecutive days. So they're open, like most farmers market may be 1 day a week. So the downtown farmers market may operate on Thursdays every week throughout the summer. Under the code requires that it be a consecutive series to operate under a permit. That's where we've redefined that to say a reoccurring event. So the farmers market, we would consider the season as a reoccurring event on a weekly basis.
So they wouldn't have to have a separate permit.
So they wouldn't have to permit each and every week.
I see. So you could, under the reoccurring thing, you can get a permit for a season.
Correct.
Basically.
And it does have to be farmers market is defined within the code as a reoccurring event. So the other thing would be we're treating Green Bluff similar to that. It's a seasonal thing, so it typically starts in late September, early October, and runs through the month of October. But they only operate for the weekend. So rather than have to take
Any other comments?
So
Shelley, you want to add something?
This gives people an option. So if you, for example, Falco's, it's a company out in the valley, every year has a barbecue for veterans. And under the previous permitting, it would have cost them the full, $360? Is that what it would have been?
Yeah.
$430, sorry. It would have been the full fee, even though it's 1 day. Under this one, we've been able to reduce their fee. They only do it one day a year. They are high risk, so they'll be at the 300 level. If you have a company or a business, and let's say you show up at CV Craft Fair, you go out to Cheney and do a barbecue, and do their parade, and you go to Layta or something. You can look at the number of events that you do, and decide, well, if they're all one-day events and you're a level 1, maybe it's cheaper for you to buy an individual permit for each event, or maybe it's cheaper for you to go ahead and buy your annual permit. It gives the vendor options now, whereas before they didn't have an option. They just had one cost. So our goal is to ultimately provide different levels to make it more affordable. We've heard a lot from our small towns that they just can't get anyone to come and set up at their little fall festival because they don't make enough money to offset the fee that the health district charges.
Okay, any other questions of Ray? Let's go back then to the resolution. Whoops, Amber, sorry.
Oh, I just wanted to thank Shelley and all the board members that participated. You guys.
No, it's Shelley and Ray and John and.
Thank you, because
Tardy
this is a
really
lot of detail, and I'm getting most of it. I just have one question left, and that is the repeat additional. Is that when you have a company that has like two different, like Pizzerita has two stands, or what does that mean? How would that be different than the reoccurring event?
Yeah, so if somebody, let's say at the Pig Out or at the fair, those are your larger events are typically where you're going to see them. If they're running two booths,
okay,
that would allow them to do the second booth at the cheaper rate. Or if they're going to do, let's say that they're under the high risk and they start out at Hoop Fest and they're going to do the same menu at Pig Out, it would allow them to permit it at the $300 level versus the full $480.
Great, thank you.
Okay, any other questions for Ray? Keep in mind this resolution number 15-09 is simply to permit the categories of associated fees. And we'll be looking at another resolution of looking at the cost of those fees. So do I hear somebody to make a motion for resolution 15-09, please? In second?
Second.
Any more discussion? All those in favor of resolution number 15-09 signify by saying aye.
Aye.
Those against? Thank you very much. Let's go to number G then. And this is where we're establishing the fee schedule. And we pretty much see that. Any more that you would like to add to that, Ray?
No, I think that this is just mainly amending the current fee schedule,
right,
which would input these fees in there.
Okay, so that's what resolution number 15-10 amendment will do is to amend the fee schedule that we have just established. Do I hear a motion for that, please?
Move approval of 1510 as presented. Second.
Okay, any more further discussion? All those in favor signify aye.
Aye.
Okay, those against? Okay, then on number H, you want to go speak? Are you speaking to that one, Ray?
Chuck, I'm just going to really quickly say thank you to everyone, including staff, because we spent a lot of time on this. So thank you very much for the amount of work that you put into it.
Well, I would also like to add there were a lot of time spent by a member of the staff, and in order to make sure that we had a clear understanding as members of that committee of what was going on. So I, too, want to thank everybody that was so involved. There were times when many of us couldn't simply because of scheduling conflicts, but other than that, we were available. So thank you very much. Okay, Ray, let's go to resolution number 15-11, authorizing, number one, a pro rata credit on 2016 food program permit fee dues due to a surplus revenue, and two, authorizing pro rata credit on future food program permit fees in the event revenues in excess of full cost recovery. Now, that was a mouthful. So, so whether or not you can to speak in 1 minute or 2 minutes or 3 minutes,
we can
go
do
ahead.
That. So this is basically to allow the food program. We had an overage in 2013 and 2014, and it was primarily based on staffing. We had, because of the economic downturn, we had shifted some on-site inspectors over to the food program, which increased our numbers. And then as 2013-14 came along, we started transitioning those back over to the on-site. But when we replaced them, we went from 8.5 inspectors to 8. When we replace them more with entry-level inspectors, which is a huge cost savings to the program. So that accounted for most of it. Plus, we had an employee that was on long-term leave without pay. So that accounts for most of the overage right there. And this resolution is basically, one, it sets $25,000 aside to keep in a reserve that if we don't meet our goals of a 17% reduction towards recovery for the TFEs, this would help to cover that cost. So if we only recognize a 10% reduction for the year of 26, we can pull out of that reserve account for that $25,000. Secondly, that would allow us, the intent is that we would give this back to the permittees that paid it in. And so if this is approved, starting January 1st on our permits, their fee will remain at the 2016 fee, but they will be shown a credit reduction towards their annual fee. And the nice thing about doing that is it allows us to keep our permit fees stable, which is what the Food Advisory Committee really wants, is not to see our fees go up and down. And this, in the future, also will allow us that if we do make a profit, this is a method in which we would give it back to the establishments.
Okay, any questions, Ray, on that? Okay, do I hear a motion to that effect, please?
Move that we approve Resolution 15-11.
Do I hear a second? Second. Okay, any further discussion? Hearing none, all those in favor signify by aye. Aye. Those against? Okay, that passes. I would also like to make a comment at this point in time before Bart checking. You know, the commissioners at one time, I think on December the 1st, recommended they set aside $100,000 for this particular, making sure that it went for assisting and helping with some of the fees and that. And now with a surplus going into 2016, Shelley, I guess I'm asking that for information only, I would like the commissioners to go back and reevaluate that portion, if you would, because it's not necessary at this time and because of what the health district has done. So I'd appreciate very much if you'd look into that. Okay, other than that, board member check-in, starting with you, Ed, John, Shelley, Doctor.
Well, just one thing. I would like to thank David. I've had the chance of working with David for a number of years. I've appreciated his input, his knowledge in public health, his never empty chocolate bowl. And I just hope that his replacement knows the need to always have Dub chocolates or something similar available to board members and staff. Thanks, David.
Yeah. I went there one time, so I missed out on a lot. You must have gone there quite often then, is that for the chocolate? Yeah. I would just like to add at this time to thank the board for the last 2 years as your chair. It's been one of the experiences of working well together. We've done a lot of things, and it's just a start of what things we can do. And you know, thanking all the different committees and for the governance committee with Keith and with Linda working with that, with Doctor, with working on the educational committee, John, you were working on the policy committee, and you know, I could kind of go on and on of the board members that stepped up. And it's surprising because sometimes as board members, we're so involved in so many other different agencies that we have to prioritize of where we can be or where we can't be. And sometimes the agency staff expects us to know everything that we're supposed to know, and really we don't know all of that. And that's why it's extremely important that we take the resources of staff, and for instance, the health regional board staff, and I can only say to the administrative staff for the regional district, you know, you've done absolutely a great job. I'm very proud to have been the visible person as the chair, at least, to be able to speak very proudly of what you've done. But I also know the staff has played such an important role in making it what we are. And so I'm just simply saying thank you very much for giving me the opportunity for the last 2 years to be in the chair, but thanking all of you, and you know, ho ho ho, Merry Christmas and Happy New Year. And at that point in time, I think I'm going to ask for adjournment.
Oh, I just.
Oh, I didn't see your hand then.
Oh no, I just wanted to say.
No,
Actually, I just wanted to say thank you to Dr. Joel for accompanying me last week. Oh, sorry. I wanted to say thank you to Dr. Joel for accompanying me last week to Second Harvest Food Bank. Right before Tom's Turkey Drive, we were able to go out to their preparation and distribution facility and go through there. And they're doing a lot of excellent work in the community. And there might be some opportunities for some increased synergies between the health district and Second Harvest. But we are definitely partnering with them on a number of things that I was unaware of. So thank you very much for making the time and coming out.
Any others?
Well, Chuck, since you spent so much time and breath thanking us, I think we need to go right back at you. We're all on a lot of these boards, and generally the chairs change every year. And because of that, sometimes it's hard to have some of the continuity we'd like in leadership positions. You being chair over these multiple year spans, I think, really was great for the board. It was great for me. I would just say I think we got to do some projects like the governance committee, the policy committee, that wouldn't have happened maybe if we turned over each year in the last 3 years. So that effort is much appreciated, and I think the board is better for it.